Welcome to the Preventive Services Program Screener Calibration. By completing this calibration course, you will be eligible to take part as a screener in a PSP event. This calibration ensures all PSP screeners throughout the state of Missouri are collecting data in a consistent and reliable manner. Throughout this presentation, we will refer to the Preventive Services Program as PSP. Thank you for your interest and participation. You may ask why we are requiring oral screening calibration. It is essential that everyone screen children in the same manner. As you can see from the slide, with multiple screeners, diagnosis and treatment plans can vary greatly. Set criteria are used and everyone must follow the criteria. The basic screening survey is an underestimation of oral disease and is used in all state and national surveys. PSP oral screenings are considered a form of public health surveillance to be used to ultimately improve oral health for the public. PSP screenings follow the guidelines of the Basic Screening Survey tool developed by the Association of State and Territorial Dental Directors. PSP screenings are not a form of data collection to be used for oral health research. The course will take approximately 30 minutes to complete. The YouTube training presentation will advance automatically. You may stop and start this course at any time. At the conclusion of the course, please complete the Calibration Completion/Registration form. This form will register your completion of the training. Completing this form is essential to accurate accounting. You will be asked to insert a completion code when completing this form. The code is SCREENER. This calibration course is required annually. You will earn a 1-hour continuing education certificate at the completion of this course. This course will provide you with a basic overview of the Preventive Services Program, assist you in preparing an area for screening, and prepare you to properly complete the PSP screening form. The intent of PSP is to mobilize a community toward protecting the oral health of its children. People across Missouri are gathering together for PSP events to make a difference where they live. Essential to the success of the PSP is the community-wide involvement of various groups toward this common goal of children's oral health. Examples of these groups include schools, child care facilities, dental professionals, FQHCs, community dental clinics, hospitals, and businesses. PSP has 4 components. The first component is surveillance, or also known as a screening. A screening of the oral health of a community's children is conducted once per year by a dentist or dental hygienist who has completed this online calibrated training course. The second component is oral health educational materials and programs that are built into the PSP structure. Prevention is the third component of PSP. To prevent decay, fluoride varnish is applied twice per year by trained community volunteers. The fourth component is referral. Children identified as needing early or urgent dental treatment are referred for care. PSP is designed for children of all ages, infants through high school. You will be one of many involved in a PSP event. As you can see from this chart, it takes many hands working together to implement a PSP event. Licensed dental professionals serve as screeners. Parents, nurses, and others interested in assisting can apply the varnish. And there's also room for others to escort children to PSP event space, provide oral education, hand out educational materials, and assist as recorders for the screeners. What is a dental screening? Please know that this screening is not meant to be a thorough clinical exam. No radiographs will be taken. This screening will not result in a diagnosis or a treatment plan. The screening is designed to identify obvious decay and provide a profile of the oral health of the children in a community. The Department of Health and Senior Services, or DHSS, Oral Health Program provides free of charge many of the supplies that are necessary for a PSP event. These supplies include screening forms, disposable mouth mirrors, fluoride varnish, toothbrushes, toothpaste, floss, and educational materials. These supplies will be ordered by the PSP coordinator of your local event, typically a school nurse, and delivered directly to the PSP coordinator's location. There are some other items you may need to bring with you since the coordinator of the event may or may not be providing. Please check on this to verify what you will need to bring with you to the screening. These may include face masks, gloves, light source, safety glasses, or eyewear, and a hand sanitizer. We ask that you do not use loupes while conducting the PSP screenings. The basic screening survey criteria, which PSP follows, discourages the use of loupes. 2 straight-back chairs will be necessary for the oral screening, one for yourself and one for the child. A tabletop or desk near your work area will make your supplies easy to access. A wastebasket will be necessary for disposables. You may conduct the screenings standing or sitting, whatever is most comfortable to you. If you are screening infants or toddlers, it will be easier to see in the mouth if you use the knee-to-knee positioning, also known as a lap exam position. Notice the child's hands in the picture. They are held by the person without the dental gloves on. This will prevent the child from reaching up to interfere with a screening or fluoride varnish application. To help maintain each child's privacy, be discreet in discussing your findings. Some children will have dental decay and poor oral hygiene. Position the screening area away from waiting crowds of children. CDC and OSHA have provided Basic Screening Survey, or BSS, infection control information to consider while conducting oral screenings. Use routine infection control guidelines. New gloves and a new mouth mirror are to be used with each child. A mask should be worn at all times while conducting the oral screenings. Please use hand disinfectant frequently as you conduct oral screenings. PSP uses the format of the Basic Screening Survey, which is a tool endorsed by the American Association of State and Territorial Dental Directors. Only licensed dental professionals may conduct the screenings. Licensed dental professionals will have a familiarity with both primary and permanent teeth as well as normal and unusual findings. The surveillance data will be used by Missouri to report the oral conditions of our children. Therefore, we need the data to be collected as accurately as possible. DHSS will provide as many screening forms as needed, and DHSS will supply large envelopes or boxes with postage-paid labels for returning the screening forms. The PSP event coordinator will take care of this at the end of the event. Upon receipt of the completed screening forms, DHSS will scan the screening information into our database and generate the reports on the results. This will provide an overall profile of the oral health of the children screened. No individual child will be identified. The data will be reported as aggregate data for your event or area. The PSP screening forms may be completed in either permanent marker or pen. It is important the marks made on the forms are made dark enough so that the scanner can read them. In marking the categories, it is essential that each circle be completely filled in. Please do not use check marks, X's, dashes, or lines. Some recorders find that using a permanent fine-tipped marker works very well for coloring in the circles, but it may be necessary to use a sheet of paper under the screening form to prevent bleed-through to the other screening forms. Simply fill in the circle to mark the appropriate response to each question category, and only one answer per question, please. If an error is made, please discard the screening form and begin again with a new form. There is an online PSP screening form submission option to complete the screening form. The process is quick and easy. You'll be asked to use your personal device, like your cell phone, to enter the screening data. Ask your PSP event coordinator if the PSP online method will be used at your screening event. The school coding information at the top of the screening form is very important. The screening date is the date the event is taking place. The school name is simply the name of the school. Minor abbreviations for the school code are acceptable, but please avoid vague 2 to 3 letter abbreviations. For example, in Poplar Bluff, you may wish to write POPBLF. Avoid the brief abbreviation of PB. You may also use a stamp or adhere a label with the date, school name, and county of PSP event location. For the county where the PSP event is held, please ask the school nurse or the PSP event coordinator to ensure you are entering the correct county. Do not enter the county of your residence unless it is the same as the PSP event county. To save time, it is allowed to enter the information for the top 3 boxes on every 10 to 15 screening forms instead of every screening form. Please do not leave any questions unanswered. Questions left unanswered are not tabulated into final data results. Do not use check marks or X's. All bubbles must be completely filled in. If an error is made, discard the paper form and get a new one. Please note the 2 examples of incorrect and correct markings for the screening form on the slide. Categories 1, 2, 3, and 4 on the screening form request demographical data. This information provides a profile of the population. Number 1, gender, is determined by visual observation. Number 2, race. Select the race of the child based on your best determination or guess. Do not leave this question blank. Number 3, age. You may wish to ask the child for this information. Number 4, grade. Ask the child. In the interest of saving time, the information for categories 1, 2, 3, and 4 may be collected by someone who is assisting as a recorder. A small flashlight is the best tool to use for viewing inside the mouth. A mouth mirror can be used for retraction. Please do not give the mouth mirror to the child to keep. The mirrors become toys and are often passed from one child's mouth to another. Remember, we are only recording teeth with obvious decay. The category of oral hygiene is number 5 on the screening form. This is an overall determination of the presence of soft deposit and its effect on the gingival tissues. The mark of not satisfactory is reserved for moderate to heavy plaque or materia alba and red enlarged tissues. If there is little to no visible plaque or materia alba present and the tissues are, for the most part, pink and firm, mark the child's oral hygiene as satisfactory. The category of sealants is number 6 on the screening form. Only record sealants that are present on permanent molars. As you know, sealants come in many different shades, from clear to white to pink. Some are translucent and some are opaque. Use your best judgment. If you see a sealant and it is only partially retained, still mark sealants. Differentiate between sealants and glass ionomer composite restorations to the best of your ability without a dental instrument. The category of rampant caries is number 7 on the screening form. If you see evidence of decay, restorations, or missing teeth, which are a result of decay on 7 or more teeth, please mark yes in this category. The key here is 7 or more teeth impacted in any way by decay. Here is an example of rampant caries. This is noted by the obvious dental decay on 7 or more teeth. The category of treated decay is number 8 on the screening form. Note, the categories here are specific to the types of teeth within the mouth. For example, primary teeth only, primary and permanent teeth, or permanent teeth only. Mark treated decay when you note any of the following. Restorations, either temporary or permanent. Restorations, whether partially or fully retained. Crowns, placed due to decay, or missing teeth as a result of decay. Restored or missing teeth that are not a result of decay are not to be considered as treated decay. The category of untreated decay is number 9 on the screening form. Note that once again, in this section, the categories are specific to the types of teeth within the mouth. For example, primary teeth only, primary and permanent teeth, or permanent teeth only. A tooth is coded as untreated decay when the screener can readily observe the breakdown of the enamel surface. White spot lesions are not considered untreated decay unless there is a breakdown of enamel. An oral screening results note should be completed by the oral screener after the screening is completed for each child with unmet dental needs. The note would indicate the child's name, date, and either early or urgent dental needs. The school nurse can make a copy of the note and send the original home with the child to inform the parents. The school nurse can follow up to ensure dental needs are met. Here are some other points to consider when coding untreated decay. Retained roots resulting from severely broken down decayed teeth are considered untreated decay. Chipped or broken teeth are considered sound unless decay is also present. Temporary fillings are not to be considered as untreated decay. The widespread use of silver diamine fluoride, or SDF, in dental clinics and dental offices is not a common treatment at this time in Missouri. Therefore, we, the Department of Health and Senior Services, are not collecting data on SDF, which is also classified as potentially arrested decay. However, we would like for you to become familiar with the appearance of a tooth treated with SDF in the event you do see a child with an SDF-treated tooth. The images show a glossy, dark, black color within the decayed lesion and on the teeth. Silver diamine fluoride is an option for caries control and can be applied directly to a carious lesion. Silver diamine fluoride, or SDF, arrests active carious lesions. It is indicated in treating caries in uncooperative young children, children with multiple carious lesions, and children with a high caries risk. In answering questions 9 and 10, please remember the PSP oral screening is based on a visual assessment only. Thus, use your best professional judgment on determining if a tooth is treated with SDF. If a tooth is treated with SDF, the tooth is considered to have arrested decay when the screener can readily observe breakdown of the enamel surface and is dark and black and appears to have a hard, glossy appearance. For question number 9, untreated decay, the SDF-treated tooth is considered and marked as untreated decay. If no other teeth in the child's mouth have untreated decay, then question number 10 would be marked as no obvious problem. Remember, teeth treated with SDF are considered to have arrested decay, thus the reason for marking as no obvious problem on question number 10. Keep in mind we are only looking for obvious decay. If in doubt about the presence of decay, assume it is not. The basic screening survey is an underestimation of decay. The category of treatment urgency is number 10 on the screening form. There are 3 choices in this category. They are no obvious problem, early dental care, and urgent dental care. When marking no obvious problem, you are indicating that there are no obvious signs of need for current treatment. By this you mean there is no need, at this time, for dental treatment, but the child should see a dentist for regular checkups. This is an example of no obvious problem. When marking early dental care and treatment urgency, you are indicating that treatment is needed within several weeks of screening. In other words, the child is not in immediate pain, but the same early treatment is probably needed before the next routine dental visit. This slide outlines conditions that might require early dental care. These include a cavitated lesion or a lesion where the enamel is breaking down. Early dental care includes both pit and fissure and smooth surface decay with no pain or infection but needs treatment. This is an example of a child's tooth that would be marked as needing early dental care. Note that there is obvious decay on the primary molars. This is noted by the breakdown of the enamel and darkening of the surrounding occlusal surfaces. Treatment urgency for urgent care is marked when you feel that treatment should be given to the child within 24 to 48 hours of the screening. This may be due to the presence of an abscess, a draining fistula, or swelling or other painful ulceration. This is also the category you should mark if the child has limitations to his or her daily activities due to dental pain. These activities include eating, playing, going to school, or sleeping. You may need to ask the child, parent, or caregiver, if available, some questions to ascertain this information. Here are 3 obvious examples of conditions that would be marked as urgent care. Note the buccal abscess on the top photo and the obvious decay in the other 2 photos. Let's take a look at some photos and try some simulations. How would you mark this one? Would you consider it untreated decay? Sure, the presence of darkness on the first molar and breakdown of enamel on the tooth structure indicates that category. This would be marked as early dental care. How about this one? The answer is yes to untreated decay. This image shows an excellent example of a cavitated smooth surface decay on the primary lateral. What would you say about this tooth? In the treatment urgency category, would you mark no obvious problem, early dental care, or urgent dental care? This appears to be stained pits only. Therefore, no obvious problem is indicated. Please remember, if you are in doubt, be conservative. What would you say about the conditions in this mouth? How would you mark the treatment urgency category? No obvious problem, early dental care, or urgent care? The decay appears to be large and chronic. No pain, swellings, or draining fistula are observed. However, the lack of symptoms could change at any time from no pain to an abscess and excruciating pain. This child's mouth would be marked as urgent care. What would you say about the conditions in this mouth? How would you mark the treatment urgency category? No obvious problem, early dental care, or urgent care? The presence of a periapical swelling likely puts this child in the urgent care category. This now completes the oral screener calibration course. To participate as a screener in a PSP event, you must complete the registration form on the webpage. In order to obtain CEUs, you must also participate in the questionnaire on the webpage. You must answer each question correctly in order to automatically be allowed to move on to the next question. After answering all questions correctly, you will be emailed the oral screener calibration certificate worth 1 CEU within 1 to 2 weeks. The PSP screener calibration is required annually. Thank you for joining with others to improve the oral health of Missouri's children. If you have any questions, please contact the Office of Dental Health at 573-751-5874 or visit our website, psp.health.mo.gov. You will be able to locate information regarding oral health and the Preventive Services Program on that page. Thank you for helping to improve the oral health of Missouri's children.